Good morning, everyone. I know we're running a bit late, so I'm just going to go ahead and get started. Welcome to session 6, which is ensuring patient access and health equity. I believe they'll get the slide up there in just a moment. And I think it's a perfect follow-on to this last session, as well as the excitement of the last days. I think Dr. Manara said expanding what's technically possible. And I think the last day of this session on integrated diagnostics has really allowed us to think of making the improbable possible. The little anecdote, sorry to call it a little anecdote, but of having the pathologist and the radiologist in the same room to look at their data, have it be data-driven and solve problems, I think resonated with all of us. And I think data sharing, having those data, and really delivering on those promises. But I think in this session here, we're going to really discuss making sure that there's health equity in every one of our novel innovations, including integrated diagnostics. I guess I should have started. I'm sorry. I'm Beth Carlin. I'm a gynecologic oncologist. I'm a clinician. I'm an end user. I see patients and do surgery. I'm a professor in the Department of Obstetrics and Gynecology at UCLA, and I direct cancer population genetics in our Johnson Comprehensive Cancer Center. I'm joined by my wonderful co-moderator. You can introduce yourself.
So I'm Wendy Nelson. I'm from the National Science Foundation, and I'm the Deputy Division Director in Information and Intelligence Systems, which funds most of the research on AI in academia.
So we're a good partnership for today's session. We have 3 speakers in this session. I'll go ahead and get started, and I think you'll see how they, too, integrate well into the mission for the conference and for today. Our first speaker is Regina Barzilay, who's at the School of Engineering. She's a distinguished professor of AI and health, and a MacArthur Fellow, and an AI lead at the Jameel Clinic at MIT. Next is a National Cancer Policy Forum member and good friend to all of us, Randy Oyer, who's a clinical professor of medicine at the Perelman School of Medicine and the executive director of the Ann B. Cancer Institute and Cancer Services at Penn Medicine in Lancaster, at Lancaster General Hospital. And then Professor Otis Brawley will be with us virtually. He's the Bloomberg Distinguished Professor of Oncology and Epidemiology at the Johns Hopkins University and Associate Director of Community Outreach and Engagement at the Sidney Kimmel Comprehensive Cancer Center. I introduced all 3 speakers again in light of time, and I think we'll have a robust discussion at the end. Each speaker will have about 10 minutes, and then we'll go to our open panel.